Hi, I'm Dr. Annalene Weston, Dentolegal consultant at Dental Protection. Welcome to RiskBites, a series of podcasts created specifically for dental practitioners in Australia. RiskBites looks at the key dental legal risks and issues affecting dental practitioners across Australia and provides helpful advice and guidance on how to steer clear of them, leaving you free to provide safe and high-quality dental care for your patients. So in this edition, I'm joined by my colleague and fellow case manager, Anita Kemp. Hello, Anita.
Hey, Annie.
And today we're diving into two topics that sit at the heart of safe and effective dental practice, scope of practice and shared care. So let's get started.
Okay, so great to be here firstly. These are such important topics and I'm glad we're shining a light on them. Now, as you know, the Australian health system in general is renowned for its high standards and commitment to patient care. And central to the system is the APRA and National Board's Shared Code of Conduct and Scope of Practice Registration Standard, which provide a framework for ethical and professional behaviour for dental professionals.
Well, let's start with scope of practice then. So I know my recent podcast with Kristen delved into this in detail, but can you refresh our memory and give us a quick recap for our listeners and perhaps anyone who didn't catch Kristen's podcast?
Sure. So scope of practice refers to the boundaries of what a practitioner is trained, educated and competent to do. It's not a one-size-fits-all or even within the same title or division. So, for example, let's take dental therapist or maybe an OHT. Your scope depends on your specific training, experience and competence.
Right, and Kristen mentioned that in terms of OHPs, there's been some changes in recent years, haven't there?
Yeah, look, so before 2020, dental therapists, hygienists and OHTs had to work under structured relationships with dentists. That's now changed. We've been given more autonomy, so we're no longer required to work under direct supervision. But we are strongly encouraged to collaborate with dentists and other professionals to ensure patients get the best care.
Indeed, and this is where it can be a bit murky, of course, because autonomy for any practitioner, whether it's a dentist or an OHP, can sometimes lead to confusion, especially when different practitioners have different backgrounds or different scopes of practice.
Exactly. And that's why the Scope of Practice Registration Standard is so important, because it clearly states that we must only work within what we're trained and competent to do and refer the patient on when a case goes beyond that.
So in practice then, Anita, what recommendation or advice would you give to a practitioner if they're unsure if something's within their scope?
Refer. That's always the safest and most ethical decision.
Yeah, if you're not sure, definitely. Okay, great. So let's talk about shared care now. So, Anita, what does this look like in dental practice?
Well, shared care is really about collaboration. Sharing patient care is something that we naturally do simply because we don't work in isolation. Even if you're a sole practitioner, you work alongside a team and refer patients for various aspects of their care. But I guess this can be even more relevant if you work in a multi-practitioner practice with many colleagues, various specialties and other health disciplines. Now, in complex cases, you're often working with dentists, specialists and sometimes other health professionals like GPs, medico-specialists, therapists, etc. And essentially, this is where our code of conduct is so important because it outlines some principles for what makes shared care work. Things like strong communication, clear roles and patient-centred approach.
So can you break down some of those principles for us, please, Anita?
Absolutely. Now, the exact wording around these principles can be found in 5.1 and 5.2 of the code, working with other practitioners. And one point I want to flag with our listeners is that it clearly states that working in a team or collaboratively does not alter your personal accountability for professional conduct and the care you provide. Now, to quote these principles, 5.1 of the code says that good practice includes that you, A, communicate clearly, effectively, respectfully and promptly with colleagues and with other practitioners caring for the patient. B, acknowledge and respect the contribution of all practitioners involved in the care of the patient. And C, behave professionally and courteously towards colleagues and other practitioners at all times, including when on social media. So in brief, that we respect and value everyone's contribution.
Yeah, I love that. And I love the opportunity to go through what the code says, because I think it's something that we probably all ought to read a little more than we do. So what about 5.2, Anita?
Okay, so 5.2 says good practice includes that you, the practitioner, A, understands the role of other team members and attend to the responsibilities associated with that role. B, advocate for a clear delineation of roles and responsibilities, including that there is a recognised team leader or coordinator, even though care within the team may be provided by different practitioners from different health professions within different models of care. C, communicates effectively with other team members or practitioners, including to support continuity of care. D, informs patients about the role of team members or other practitioners and be clear who has ultimate responsibility for coordinating the patient's care. E, act as a positive role model for team members. And F, support students and practitioners receiving supervision and others within the team. So again, and to recap, in really simple terms, that you facilitate timely and accurate communication between all practitioners, apply principles of teamwork, not just within the dental divisions, but across other health disciplines, foster patient involvement, so they should know who's involved in their care and be part of the decision making, and ensure continuity of care so patients don't fall between the cracks.
Yeah, and I really like that it reinforces this whole concept of mutual respect between colleagues, but also that you remain responsible for your own professional conduct.
Yes, you sure are. Collaboration doesn't mean you hand over accountability. If you're part of a team providing care, you still need to practice within your scope and ensure your piece of the puzzle is solid.
Okay, Anita, so let's touch on delegation, something I think that can be misunderstood and often, I think, done quite badly, which is why it stresses some people out. So what does the code say about this?
Okay, so again, the exact wording around delegation can be found in 5.4 of the code. But essentially it says you need to be really intentional. So again, in simple terms, if you delegate, refer or handover care, you must make sure the person you're referring to has the right skills and qualifications. Understand that while you're not responsible for their actions, you are responsible for the decision to delegate, and always provide enough timely info to ensure safe, continuous care.
That's great. So like all delegation, it's not about ticking a box, it's about thoughtful coordination.
Exactly. If you're handing over care without clear communication or assuming someone else will catch it, you're risking the patient's safety and potentially your registration.
Indeed. So some final thoughts. And I've got to say, this has been such a valuable conversation, Anita. Thank you. So before we wrap up, what would you say to early career dental practitioners navigating these responsibilities?
Yeah, look, I'd say know your scope, respect your colleagues, and never hesitate to refer or ask questions. Shared care can be incredibly rewarding, but only when everyone, including the patient, is clear on their role and the plan is well coordinated from the start.
Yeah, those are wise words, Anita, and definitely remembering that the patient is part of the puzzle and part of the communication is key. And to our listeners, please remember that ethical care isn't just about what you do, but it's knowing when to collaborate, to refer, or to step back. So thanks so much, Anita, and thank you all for listening. And we do hope that this podcast was helpful to you, and we look forward to sharing more guidance with you in the future. If you like Dental Protection podcasts and you'd like to hear more, please subscribe and leave a review.